This program is made possible in part by the Moving Image Trust Fund.
Back with Dr. Sam Taggart on our web extension of our over-the-air broadcast. There is some concern now with the latest Ebola outbreak, and now at the time we're taping this program, I think 2 American citizens, both ironically clinical volunteers, have now been brought back to the United States. And this has triggered some concern on the part of some individuals that, oh my heavens, now we have this this incredibly destructive virus on our shores. Your thoughts on that?
2 things I think that and again, I would suggest to you that you probably would need to get somebody from one of the guys from the health department to talk more in depth about this, because they understand this a lot better than I do. But one of the things about diseases that kill everything in sight is they burn themselves out. Okay? Illnesses like tuberculosis and malaria and typhoid that don't kill the patient, but simply disable the patient and let the patient go somewhere else and scatter the disease, okay, tend to be probably more of a big long-term concern, okay? Now, if you take an illness, and I'm going back to some things that I do know a little bit about, and you go back to the flu of 1918. We didn't get a chance to talk about that earlier, but you go back to the flu of 1918, okay? It hit a population, and it was a virus. The flu had been around for centuries.
Right.
But the bug had a shift or a drift, nobody knows for sure, in its genetics, so that the population couldn't recognize it. There were 2,000 people in the state of Arkansas who died as a result of war injuries during World War I, 2,200 people. There were 7,000 people died as a result of the flu. The only place in the state of Arkansas that did not have the flu during World War I was the TB Sanatorium in Booneville, because they isolated all of the staff and all of the patients from the outside. As long as the flu was going on, they would not let anybody come and go. They were a self-contained unit, so they did not have any flu. That was the only place in the state. And that leads around to what, at the beginning of the 19th century, the doctors were still arguing about whether most of these dreadful diseases that we see are contagious or not contagious. Was it due to some epidemic constitution of the weather and the temperature and the decaying organic matter that was in the streets? Was that what created these diseases, or was it some kind of little animalcule, some kind of little bug that caused the illness? But human beings, the people who lived in Arkansas, the people who lived in the South, people who lived in the world, at the first sign, first time anybody mentioned smallpox or cholera or yellow fever, they ran, because they clearly understood they were.
It was bad stuff.
They clearly knew. And when you look back at yellow fever, which is about as good a metaphor, I guess, to Ebola for us now, if we had Ebola here, about as good an example of that is that across the Delta, okay, there were shotgun quarantines. Okay, if you came up to a town and they didn't know you, you were told to go away through the sights of a shotgun. And so quarantine was then and now and is now. If you look at all the things that are being done to help prevent the spread of Ebola, the base of it's quarantine.
Still the most effective.
It's still the most effective thing. It's quarantine. Okay, it's not an immunization of some sort. You know, that's not true smallpox, and it's not true with most of the things. But it's true for some of these diseases. It was quarantine. It was keeping it from spreading. One of the things that came back to really bite them during the cholera epidemics of the 1880s or 1830s was that there were enough people who could get it who didn't have a disease. They would hear the word cholera and they would run. And when they ran, they took the cholera with them. Okay, so the next town got infected.
Right.
Okay, but if you look at the approaches like to yellow fever again in the late 1880s,
right,
the most important thing they did was quarantine. Okay, was quarantine, and they put quarantine stations all the way from Hopefield, which is where West Memphis is, Hopefield and Mariana and Helena. The state put quarantine stations and said, don't get off the boat.
There is, I suppose, an inherent social or cultural risk in it, however effective quarantine might be. It almost evokes a biblical, unclean, right, stay away. Right. Hansen's or
leprosy.
Leprosy,
yeah.
Yeah, right. Isolate the lepers. Right. And we had that. I can recall well, as many of our viewers can, in the early days of AIDS. There were many called AIDS. People with AIDS should be isolated. I mean, they should be kept away. And then we discovered that you got to work hard to get AIDS.
So, I think one of the things about AIDS, we were mentioning it just a second ago. AIDS, unlike things like Ebola and the like, okay, don't kill you immediately.
All right.
They're not obvious. The same thing was true for syphilis. Okay, syphilis it was another one of those illnesses that wasn't necessarily thought of as a venereal disease until probably the 20s. Okay, it was just a disease that people got, and it didn't kill you quickly, so you could spread it without knowing you had it. AIDS is the same way. Right. Ebola is not that way.
Right. I mean, it's.
And there are several of those diseases that back during the time of 9/11 we were worried about. How do you deal with these purposeful or bioterrorism?
Right.
How do you deal with purposeful infection being injected into a community?
Dr. Sam Taggart, an absolute pleasure.
Yes, sir. Thank you.
Thank you very much. We look forward to your next work.
Oh, good. I hope so.
Well, I hope you'll come back.
I would be just tickled to death to do so. I'd be tickled to death to do so.
Thanks very much for being with us.
Yes,
Thank
sir.
you for your time. We'll see you next time.
Thank you.
This program is made possible in part by the Moving Image Trust Fund.